Imagine this. You wake up one morning, your legs are swollen like balloons, your urine looks darker than your morning coffee, and you feel exhausted in a way that sleep simply cannot fix. You go to your doctor, and after a few blood tests, they sit you down and say four words that change everything. Your kidneys are failing. And here is the most heartbreaking part. It did not happen because of some rare disease. It did not happen because of bad luck. It happened because of pills. Pills that were sitting right there in your medicine cabinet. Pills your own doctor prescribed. Pills you trusted completely. I am Dr. Jennifer High, a board-certified nephrologist. That means I am a kidney specialist, and I have spent over 2 decades watching patients in their 60s, 70s, and 80s walk into my clinic with kidneys that are silently being destroyed. Not by cancer, not by diabetes alone, but by everyday medications that most people never think twice about taking. Here is something that will shock you. Your kidneys filter approximately 200 liters of blood every single day. Every toxin, every chemical, every drug you swallow, it all passes through those two fist-sized organs sitting quietly in your lower back. When you are young, your kidneys have a remarkable ability to handle this chemical load. But after the age of 60, kidney function naturally declines by roughly 1% every single year. That means by the time you are 70, your kidneys may be working at only 70% capacity. By 80, possibly 60%. And when you add certain common medications on top of already aging kidneys, the damage can become permanent, irreversible, and life-threatening. Today, I'm going to tell you something your pharmacist never wrote on that little orange bottle. I am going to name the 5 most common pills that are quietly destroying kidneys after age 60. And then I will give you 3 simple, proven ways to protect yourself starting today. This is the conversation your doctor should be having with you, but often does not have time to. So let us have it right now. Let us start with the number 1 offender. And I promise you, this one is in almost every senior's medicine cabinet right now. NSAIDs, non-steroidal anti-inflammatory drugs. I am talking about ibuprofen, sold as Advil and Motrin, naproxen, sold as Aleve. These are the pills millions of people reach for when their knees hurt, when their back aches, when arthritis flares up on a cold morning. Let me paint you a picture. Margaret is 67 years old, lovely woman, retired school teacher. Her hip hurts every morning, so for the past 3 years, she takes 2 ibuprofen tablets before breakfast, just to get moving. Nobody told her to stop. Her primary care doctor knows about her hip pain. What nobody connected was that her kidney function had dropped 35% in those same 3 years. Here is why this happens. Your kidneys rely on something called prostaglandins. These are chemical signals that keep blood flowing properly into the kidney tissue. NSAIDs block prostaglandins completely. In a young, healthy kidney, this is a manageable stress. But in an aging kidney that is already working harder to maintain blood pressure and blood flow, blocking those signals is like removing the traffic lights on a busy highway. Things crash, blood flow to the kidney drops, kidney cells begin to starve and die. And because kidney damage has no pain receptors, Margaret felt absolutely nothing while this was happening. The damage from NSAIDs in older adults can occur in as little as a few weeks of regular use. I have seen patients develop acute kidney injury from a single week of daily ibuprofen during a bad cold. If you are over 60 and you are taking any NSAID regularly, even once a week, this is a conversation you need to have with your doctor today. Now let us talk about the second pill. This one surprises people every single time I mention it in clinic: proton pump inhibitors, PPIs. These are the acid reflux medications. Omeprazole, sold as Prilosec. Pantoprazole, sold as Protonix. Lansoprazole, sold as Prevacid. These are among the most prescribed drugs on the planet. People take them thinking they are completely harmless. After all, they are available over the counter. What could go wrong with a heartburn pill? Think of it this way. You know how rust slowly eats through metal, silently, invisibly, until one day the whole structure collapses? That is exactly what long-term PPI use does to the kidneys in some patients. It causes a condition called chronic interstitial nephritis, a slow, quiet inflammation of the kidney tissue that progresses for years without a single symptom. Studies have found that people taking PPIS long-term have a significantly higher risk of developing chronic kidney disease compared to those who do not. The risk increases the longer the medication is taken. Many patients I see have been on PPIS for 5, 10, even 15 years because nobody ever told them it was supposed to be a short-term solution. If you have been taking a PPI daily for more than 8 weeks without a specific ongoing medical reason, ask your doctor whether you truly still need it. The third pill on my list is one that almost every older adult with heart disease or blood pressure issues is taking: diuretics. Water pills, furosemide, hydrochlorothiazide, spironolactone. Now, I want to be very clear here. Diuretics are often medically necessary and save lives. I am not telling you to stop them, but I am telling you they carry a real and underappreciated kidney risk that requires careful management, especially after 60. Here is the problem. Diuretics force your kidneys to flush out water and sodium. That is their job. But when the body loses too much fluid, especially in summer heat, during illness, or when someone is not drinking enough water, the blood volume drops. When blood volume drops, the pressure pushing blood through your kidneys drops. And when kidney filtration pressure drops, kidney cells begin to suffocate. I had a patient, 72-year-old retired engineer named Robert. He was on furosemide for heart failure. One hot July, he was doing yard work, sweating heavily, not drinking nearly enough water. By evening, he was confused and barely urinating. His creatinine, a key marker of kidney function, had tripled in 48 hours. He was admitted to the ICU with acute kidney injury. The cause? Dehydration combined with his diuretic. The lesson here is not to fear diuretics. The lesson is that if you take a diuretic, hydration is not optional. It is part of your treatment plan. The fourth pill is one of the most important medications ever discovered, and yet it is one of the most kidney-toxic drugs in existence when used incorrectly. I am talking about certain antibiotics, specifically aminoglycosides like gentamicin and a widely used class called sulfonamides, including a very common antibiotic combination known as trimethoprim sulfamethoxazole or Bactrim. Bactrim is prescribed constantly for urinary tract infections, which are extremely common in older adults, especially women. The cruel irony is this: it is prescribed to treat a urinary infection, and it can damage the very kidneys that urinary system relies on. In older adults whose kidneys clear medications more slowly, these antibiotics can accumulate to toxic levels quickly. The kidney tubules, the tiny tubes inside the kidney that do the fine-tuning of your blood chemistry, are particularly vulnerable. When they are damaged by antibiotic toxicity, the kidneys lose their ability to concentrate urine, balance electrolytes, and remove waste products efficiently. This does not mean you should refuse antibiotics when you need them. It means that when your doctor prescribes an antibiotic, you should ask, given my age and my kidney function, is this the safest option? A simple question that could make a profound difference. And now, the fifth pill. This one is perhaps the most controversial on this list because it is a medication that also protects the heart. And I want you to hear this with balance and nuance. I am talking about certain blood pressure medications, specifically ACE inhibitors and ARBs, drugs like lisinopril, enalapril, losartan, and valsartan. These medications are genuinely beneficial for many patients, including many kidney patients. But here is the nuance that most patients never hear. In patients who have a condition called bilateral renal artery stenosis, meaning the arteries feeding both kidneys are narrowed, these drugs can cause a dramatic and dangerous drop in kidney filtration almost immediately. And renal artery stenosis is far more common in older adults than most people realize, often going completely undiagnosed. Additionally, when ACE inhibitors or ARBs are combined with NSAIDs and diuretics, a combination so dangerous in kidney medicine that we call it the triple whammy, the risk of acute kidney failure multiplies dramatically. If you are on all three of these medications simultaneously, your kidneys are under serious threat, and your doctor needs to know you understand this risk. Now, you have heard the dangers. Let us talk about the protection. Because knowledge without action is just worry, and I do not want to leave you worried. I want to leave you empowered. The first and most powerful thing you can do is establish your kidney baseline. After age 60, everyone should have a simple blood test called a serum creatinine and an EGFR, estimated glomerular filtration rate, done at least once a year. This is a basic, inexpensive blood test that tells us exactly how well your kidneys are filtering. Most people have no idea what their kidney function is. If you have not had this test in the last 12 months, call your doctor's office today and ask for it. You cannot protect what you are not measuring. The second protective strategy is what I call the medication audit. Sit down with every single pill, supplement, and over-the-counter medication you take. Write them all down, including vitamins, herbal supplements, and anything you buy without a prescription. Then bring that list to your doctor or pharmacist and ask them one direct question. Given my age and my kidney health, are any of these a concern? Many patients are shocked to discover they have been taking combinations of medications that no single doctor ever reviewed together. Your body does not experience your medications in isolation. Everything goes through the same two kidneys. The third strategy is the one that costs absolutely nothing and works immediately: water. Proper, consistent hydration is one of the most powerful kidney protective interventions that exists. The kidneys need a constant flow of fluid to dilute waste products, flush toxins, and maintain healthy blood pressure within the kidney's filtering units. After age 60, the thirst sensation naturally weakens, meaning your body will not reliably tell you when you need water. You must drink proactively, not reactively. The general target for most adults is 6 to 8 glasses of water daily, though your individual need depends on your medications, activity level, and any heart or kidney conditions. Ask your doctor what is right for you specifically, but do not wait until you are thirsty. By then, you are already mildly dehydrated, and your kidneys are already under stress. Here's what I want you to walk away with today. Your kidneys are not invincible. They are not endlessly forgiving. They are hardworking, vital, and, after the age of 60, increasingly vulnerable. The medications we have talked about today are not villains. Many of them are genuinely life-saving, but they carry risks that patients deserve to know about, and that risk increases significantly with age. You are not helpless in this. You are not just a passive recipient of prescriptions. You are the CEO of your own health, and today you learned something that too many people never find out until it is too late. Get your kidney function tested. Audit your medications, drink your water, have the conversation with your doctor, not someday, but at your very next appointment. Print this out if you have to. Show them this list. Ask the hard questions, because your kidneys cannot speak for themselves, but you can speak for them. I have seen patients reverse early kidney damage simply by removing the wrong medication and adding proper hydration. I have seen 68-year-olds stabilize kidney function that was declining for years just by making these changes. It is not too late, but the window matters. Every month of ongoing damage is a month of kidney function that does not come back. If this video helped you, if it gave you something you did not know before, share it with someone you love who is over 60. Share it with your parent. Share it with your spouse. Share it with a friend who is reaching for ibuprofen every morning for their knee pain. You might be giving them the gift of a kidney. And that is not a small thing. I am Dr. Jennifer High, and I will see you in the next one. Take care of those kidneys. They are taking care of you every second of every day, and they deserve the same in return.